Imagine you step onto your yoga mat, right? And you have a really specific goal in mind. You're there to heal your pelvic floor. So you take a deep, centering breath, you push back into a downward-facing dog, and completely by accident, you trigger a pelvic organ prolapse.
Yeah, it's honestly the ultimate diagnostic minefield
Oh,
because you've got this practice that is universally praised for
wow.
healing.
Right, totally.
But what structurally heals one person's pelvic floor can just actively degrade another's.
Which is wild. So today, for this deep dive, we are looking at a very specific, kind of murky and often taboo question. Does hitting the yoga mat actually help, or does it actively worsen vaginal laxity?
And to figure out the real mechanical truth there, we brought a pretty massive stack of research into the studio.
We really did. We are pulling from clinical guidelines from NHS trusts, some deep anatomical insights from the Women's Health Clinic, and specialized pelvic floor physiotherapy guides.
Plus, we have clinical studies straight off PubMed and some specialized coaching materials from expert yoga practitioners, too.
Yeah, a lot to cover.
Exactly. And the goal with all these materials is really bridging that gap between, clinical urogynecology, the hard science, and everyday movement practices on the mat.
Okay, let's unpack this, because our mission today is to cut through all those wellness buzzwords. We want to bypass the, overly simplified Instagram fitness advice and uncover what is actually happening inside your pelvis during a flow.
Right. But before we can even begin to figure out if your favorite vinyasa class is a healing balm or a hidden hazard, we kind of have to define our terms.
Yeah. Mechanically speaking, what actually is vaginal laxity?
We really have to start there because the word laxity is just incredibly misleading.
It is, yeah.
Yeah.
It immediately makes you think something is just like a bit stretched out.
Exactly. You picture an old, tired rubber band that lost its snap. But when you actually look at the clinical data, patients usually describe it as a physical feeling of looseness or a heavy sensation of lacking support.
Right.
But it isn't just about stretched tissue. In a lot of cases, it's highly associated with severe underlying structural trauma.
We're talking about trauma from childbirth, right? Like the sheer mechanical force of pushing a baby out.
Precisely. Specifically, something called a levator ani avulsion.
Okay, break that down for us.
So the levator ani is this really broad, crucial sheet of muscle. If you look at a cross-section of the body, this muscle forms the entire floor of your pelvis.
It's the foundation.
Exactly. It's the literal foundation holding up your bladder, your uterus, and your rectum. And in an avulsion, the extreme stretching of childbirth causes part of that muscle to literally tear and detach from its normal bony anchor on the pubic bone.
Wait, detaching from the bone, that is a massive structural failure. It's wild that an injury of that magnitude just flies under the radar in standard postpartum checkups.
It's because it happens acutely during the active pushing phase of childbirth, but it remains completely hidden. Doctors actually call it occult.
Oh, wow.
Yeah, so an obstetrician who is just stitching up a surface-level tear
Hmm.
simply cannot see that the deep muscle layer has ripped away from the bone.
That's terrifying. So what's the immediate consequence of that?
Well, the immediate consequence of that internal detachment is a widening of the genital hiatus.
Just to help you visualize that, the genital hiatus is the central opening in that bowl of muscle, right? The gap that allows the urethra, vagina, and rectum to pass through.
Right. And when the muscle detaches from the bone, it springs back. So that central opening physically gapes wider. You just lose the structural integrity of the entire pelvic base.
Which explains the heavy feeling.
Exactly. About 24% of women seen in a urogynecology setting report this subjective symptom of laxity. And imaging shows it's strongly associated with these massive structural changes.
Okay, so think of your pelvic floor like a canvas hammock supporting your internal organs. The muscles are the thick ropes tied to the trees, which are your pelvic bones.
That's a great way to picture it.
And if one of the main ropes snaps and completely detaches from the tree, the hammock is going to tilt and sag. The foundational support is compromised. But, and here is where the pervasive wellness narrative starts to fall apart for me. If we are talking about a structural tear, like a literal detachment of muscle from bone, there is no amount of downward dog or deep breathing that can act as surgical glue.
Right. Yoga cannot fix an avulsion. A torn muscle that's detached from bone requires medical intervention or highly specialized compensation strategies, not just a standard stretching routine.
So if you have a true structural avulsion, trying to tighten up by throwing yourself into intense yoga classes isn't just a lost cause. It seems like it could actually do more damage.
Oh, it can be actively dangerous.
Yeah.
If you don't understand the physical mechanics of your own body, certain types of yoga will absolutely exacerbate the symptoms of laxity and push you rapidly toward prolapse.
Let's get into the actual biomechanics of that damage.
Mm.
How does a practice renowned for healing end up physically harming the pelvic floor?
It all comes down to a physiological concept called intra-abdominal pressure, or IAP. Think of your human torso as a sealed, pressurized cylinder. Your diaphragm, the breathing muscle under your ribs, is the lid at the top.
Right.
Your abdominal and back muscles form the rigid walls, and your pelvic floor is the base. Every time you breathe, move, cough, or lift something heavy, the pressure inside this sealed cylinder dramatically changes.
So it's basically like squeezing a water balloon right in the middle.
Yes,
The
exactly.
pressure inside that balloon has to go somewhere. It can't go out the sides if your abs are tight. It can't go up if you're holding your breath. So it shoots straight downward onto that already weakened pelvic floor hammock.
Now apply that water balloon physics directly to a standard yoga class. You have intense, deep core work, like boat pose, right? Navasana.
Oh, yeah, where you're balancing in a V shape.
Right. You also have deep forward bends, like Uttanasana, which mechanically compress the abdominal space, and heavy inversions, like headstands. Every single one of these shapes drastically spikes your intra-abdominal pressure.
Wow. So if your pelvic floor is already struggling with laxity, or worse, a tear, you are essentially taking a sledgehammer of pressure and slamming it down onto a support system that is hanging on by a thread.
You're compounding the mechanical failure. And the poses themselves are honestly only half the problem. The real danger is how you breathe during them.
Because people hold their breath when things get hard.
Exactly. When a pose gets difficult, the natural human instinct is to brace and hold your breath. This is known as the Valsalva maneuver. You close your glottis, which is your airway, and you bear down.
And that traps the air in the cylinder.
Right. And the downward force onto your pelvic organs becomes immense. Combine that with high-impact vinyasa flows where you're jumping back into chaturanga over and over. You're creating rapid, repetitive, downward kinetic force.
You are effectively physically shoving your bladder and uterus downward, which triggers prolapse.
Yeah. And there's the flexibility aspect, too. Yoga is built on creating deep flexibility in the tissues. But when you're dealing with structural weakness, extreme flexibility is the enemy of stability.
Because you're making a loose joint even looser.
Precisely. Overstretching the pelvic floor through deep, wide-legged squats or intense hip openers can create further instability in an area that desperately requires rigid strength.
That makes total sense.
If we connect this to the bigger picture, modern fitness culture places a massive premium on deep core strength and extreme flexibility simultaneously. We celebrate it, but we don't realize this specific combination, executed with poor pressure management, is systematically crushing the pelvic floor.
That is a terrifying reality check for anyone who has been diligently hitting the mat, thinking they're doing the right thing.
It really is.
But before you roll up your yoga mat and throw it in the trash, there is a massive contradiction we have to explore.
Yes, there is.
Because if high-pressure yoga is bad for a weak pelvic floor, the logical conclusion would be to avoid it entirely and just do thousands of Kegel exercises, right? The cultural advice is always just, squeeze, squeeze, tighten it up.
Squeezing is definitely the default cultural prescription. But in a huge percentage of cases, doing hundreds of Kegels is the exact wrong thing to do, and it will make the symptoms exponentially worse.
Here's where it gets really interesting. Because the physical sensation of looseness or vaginal laxity isn't always caused by the muscles being stretched out or torn.
No, it's not.
Sometimes that exact same feeling of looseness is caused by the muscles being much too tight.
And that is the fascinating pathology of the hypertonic pelvic floor. It's a frustrating, counterintuitive paradox.
How does that even work?
Well, to understand it, look at how your body handles chronic stress, generalized anxiety, or even just habitual poor posture from staring at a screen all day.
We unconsciously clench.
Right, we grind our teeth, lock our jaws.
Exactly. We hike our shoulders all the way up to our ears without realizing it.
It's the sympathetic nervous system's classic fight-or-flight stress response. We just armor up. The pelvic floor is actually a primary emotional holding center. It reacts the exact same way as your jaw or your shoulders. It's a primitive reflex to guard your vulnerable underbelly.
Wow, I never thought of it like that.
Yeah, so chronic stress or heavy weightlifting where you never properly release the muscle, or even just holding your pee for hours on end at work. All of this commands your pelvic muscles into a constant, unyielding state of tension.
So they become essentially clenched 24 hours a day.
Right. So if you feel that single sensation of being loose and decide to try and fix it by doing a million Kegels, you are taking a tight, exhausted, overclenched muscle and demanding it squeeze even harder.
Imagine holding a heavy dumbbell in a bicep curl halfway up and just leaving it there for an entire week. By day 7, that bicep isn't strong. It is shaking, depleted, and entirely unable to function.
That's a perfect analogy. When the pelvic floor becomes hypertonic, locked in this overactive state, blood flow is severely restricted. A biological process called ischemia sets in.
Let's break down ischemia, because that's the mechanism explaining why tightness actually feels like looseness.
Yeah, exactly. Ischemia simply means a restriction in blood supply to tissues, which causes a shortage of oxygen. When a muscle is constantly clenched, the blood vessels are squeezed shut.
So oxygen can't get in, and waste products like lactic acid can't get out.
Right. The muscle becomes weak because it is fundamentally starved and fatigued. It physically sags because it no longer has the energy to maintain its healthy, resting baseline tone.
Wow. And this total cellular exhaustion creates a heavy, dragging sensation in the pelvis. And your brain misinterprets that heavy, sagging feeling as vaginal laxity.
Yes, you feel loose, but mechanically you are locked in a severe spasm. Doing Kegels in this state is just asking a cramping, suffocating muscle to work harder.
Which sounds painful.
It leads to severe pelvic pain, painful intercourse, chronic constipation, and a constant feeling of incomplete bladder emptying.
So this is where targeted, gentle yoga steps in as the absolute ultimate remedy.
Exactly. Because a hypertonic muscle doesn't need a workout. It needs a neurological intervention to learn how to let go.
And we aren't talking about power yoga or Ashtanga here. We are talking about restorative poses that actively widen the bony structure of the pelvis and allow gravity to gently pull the pelvic floor downward.
Poses like Happy Baby are highly recommended.
Mm-hmm.
You lie flat on your back, bring your knees towards your armpits, and gently hold your feet. This shape physically stretches the inner thighs and opens the entire pelvic outlet.
Child's pose is another phenomenal tool, right?
Absolutely. It gently stretches the lower back fascia and the deep pelvic tissues.
Oh.
Or a supported bridge pose, where you slide a block under your sacrum to take the entire weight of your pelvis.
That sounds amazing. It allows those exhausted muscles to finally stop fighting gravity and just rest.
But just putting your body into the shape of Happy Baby is really only half the equation. The actual mechanism of healing is entirely driven by the breath.
Right, because if you're in Happy Baby but you're panic breathing into your upper chest, your pelvic floor isn't going to release a millimeter.
Breath is the master key to the nervous system. Go back to that visual of the cylinder. The diaphragm at the top and the pelvic floor at the bottom mirror each other's movements perfectly.
Okay, so when you inhale deeply into your abdomen, utilizing diaphragmatic or 360-degree breathing, your diaphragm physically pushes downward.
And to accommodate that internal pressure change, a healthy pelvic floor has to yield. It naturally lengthens, stretches, and drops down toward your feet.
And then when you exhale, the diaphragm rises back up and the pelvic floor naturally recoils into its resting state.
Exactly. There is a fantastic visualization used in the clinical guidelines for this exact movement. They suggest that when you inhale, you should close your eyes and imagine your pelvic floor gently relaxing, softening, and opening outward like a blooming rosebud.
And then on the slow exhale, the petals just softly draw back together. I love that.
It's a powerful clinical cue because it shifts the focus from aggressive contraction to gentle release. And you can actually supercharge this by using the Ujjayi breath from yoga.
Oh, the ocean breath.
Yeah. Ujjayi involves slightly constricting the back of your throat as you breathe, creating a soft ocean sound.
Explain how that physical constriction in the throat actually changes the state of the pelvic floor, because that connection is wild.
It's pure neurobiology. By physically narrowing your airway, you create resistance. That resistance creates a physical vibration in your throat, which literally massages the vagus nerve.
And the vagus nerve connects your brain to your internal organs.
Right. When you stimulate it with Ujjayi breath, it releases a neurotransmitter called acetylcholine, which commands your heart rate to slow down. It chemically shifts your entire nervous system out of the fight-or-flight mode and into the rest and digest mode.
That is incredible. You cannot mechanically force a muscle to relax if your brain is blasting panic signals. The deep breathing cuts off the stress signal, finally allowing the pelvic floor to release that chronic tension.
And as the spasm breaks, the blood vessels open up. Oxygen-rich blood rushes back into the starved tissue. The ischemia resolves. The coaching materials note that restoring this blood flow dramatically improves cellular health, which leads to improved sexual function and a return of natural lubrication.
It's completely life-changing, but we do have to address the gap in this protocol.
Right.
Let's say you've used gentle yoga, you've mastered the blooming rose visualization, and you've relaxed your hypertonic muscles. The pelvic pain is gone, but you still have an underlying structural weakness or a mild prolapse.
Yeah, that's the catch.
Gentle yoga is phenomenal for release, but is it mechanically capable of rebuilding the upward structural support against gravity?
The clinical consensus is no. Yoga alone is highly unlikely to rehabilitate true structural laxity or lift a prolapsed organ. To rebuild that internal architecture, you need a specialized technique called hypopressives, or low-pressure fitness.
This represents a total paradigm shift in how we train the core. For decades, the industry relied on Kegels, which are voluntary muscle contractions. You actively command your brain to squeeze.
But the pelvic floor is primarily slow-twitch muscle fibers. It's designed to be a subconscious reflexive support system. It should automatically catch you when you sneeze or jump.
And hypopressives bypass the conscious brain to retrain that automatic reflex.
Exactly. The brilliance of hypopressives is that instead of increasing pressure inside the cylinder to force the muscle to work, you manipulate physics to drastically decrease the pressure.
Walk us through exactly how an exercise physically lowers intra-abdominal pressure.
It relies on precise postural alignment combined with a breathing technique known as an apnea. First, you exhale completely, emptying your lungs of all air.
Okay.
Then you pinch your nose or close off your airway so absolutely no air can enter. While holding that breath out, you forcefully mimic the action of taking a massive deep breath. You flare your rib cage as wide as possible.
You're expanding the ribs, increasing the volume of the chest container, but because the airway is sealed shut, no air can get inside to fill that space.
Right, and by the laws of physics, that instantly creates a massive drop in pressure, a vacuum inside the chest cavity.
It creates a powerful negative pressure environment. High pressure always seeks low pressure, so this vacuum acts exactly like a suction cup.
Yes, it physically pulls the relaxed diaphragm violently upward into the ribcage. And as the diaphragm flies up, it pulls the abdominal organs up with it, gently suctioning the pelvic organs, the bladder, the uterus upward, out of the pelvic bowl.
And as all those organs are suctioned upward against gravity, your pelvic floor and deep transverse abdominal muscles involuntarily fire.
Exactly. They reflexively contract and tone themselves to stabilize the core against this internal shifting.
You are achieving a deep reflexive strengthening and lifting effect, but completely without any of the downward crushing pressure of a crunch or a forced Kegel.
You are literally vacuuming the organs back into their proper anatomical position.
So, what does this all mean? It means that addressing vaginal laxity isn't just a matter of picking the right exercises off a list. It is entirely about the constant daily management of physics, pressure, and bodily alignment.
Posture builds the container. Even a minor 10-degree pelvic tilt structurally kinks the cylinder.
Right. If you walk around aggressively tucking your tailbone under, you are shortening the pelvic floor, leading to that overgripping and ischemia.
And if you stick your glutes out and dump your belly forward, you stretch the pelvic floor too far, leaving it structurally weak. You need a neutral pelvis. You want your ribcage stacked perfectly over your pelvis.
Like a well-engineered building. You maintain that structure, utilize 360-degree breathing, and blend the modalities. You use restorative yoga with Ujjayi breath to melt away tension, then integrate the apnea breath of hyperpressives to create upward lift.
It's a sophisticated dual-action approach. Yoga regulates the nervous system and creates pliability. Hypopressives rebuild structural integrity and defy gravity.
It entirely reframes what it means to practice yoga. Your time on the mat can be a weapon that further degrades your pelvic floor, or a profound healing tool. It completely depends on breath mechanics.
Exactly. If you're in a vinyasa class and feel a heavy downward pressure or a physical bulging sensation during a pose, that is your internal alarm system going off.
Skip the intense core flow. Opt for a modification. Just lie on your back, put your legs up the wall, and give your pelvic hammock a break.
Moving with mechanical intelligence is always superior to sheer force. But looking deeply into the clinical data, this raises an important question, one that challenges this entire biomechanical framework we've just built.
I know exactly the pivot you're about to make, and it completely upends the narrative.
Yeah, it really does.
We spend this entire deep dive talking about the musculoskeletal system, muscle tension, isometric pressure. But the medical sources heavily document a completely different type of trauma from childbirth, and that is neurological damage.
Specifically, the trauma inflicted on the pudendal nerve. The pudendal nerve is the main neural highway supplying sensation to the external genitals and the pelvic floor.
And during a vaginal delivery, as the baby descends, that nerve is physically stretched like a bungee cord.
Often far beyond its elastic limit. When nerve tissue is aggressively stretched, the myelin sheath, which is the protective coating around the nerve, is damaged. It stops transmitting electrical signals effectively.
And nerve tissue takes an agonizingly long time to regenerate.
For months, sometimes years. And the result of that isn't structural weakness. It's numbness. It's a significantly reduced sensation of touch and grip.
Which means you might feel loose during intimacy. You might subjectively experience all the hallmarks of vaginal laxity.
Right. You might spend a year doing Kegels, practicing hypopressives, or even seeking out invasive laser treatments, utterly convinced that your muscle fibers are stretched out.
But in reality, your structural muscle tone might be perfectly intact. The mechanics are fine, but the wiring is frayed. The brain simply isn't receiving the sensory data.
And there is an even deeper psychological component to this sensory loss. Sometimes, if a birth involves severe pain or a deeply traumatic recovery, the brain acts as an active, protective circuit breaker.
The brain engages in sensory gating. It registers that the pelvic region was a source of immense, overwhelming pain.
So to protect you from experiencing that trauma again, the brain proactively mutes the sensory input. It just turns down the volume on pelvic sensation.
Which leaves us with a truly provocative thought for you to carry with you. Consider our intense modern cultural obsession with physical tightness. This pervasive idea that we just need to squeeze harder, lift heavier, or physically alter our anatomy to feel normal again.
It really makes you wonder, doesn't it?
Could that mechanical obsession actually be blinding us to the true nature of the problem? What if the feeling of laxity isn't a mechanical failure of the muscular hammock at all, but an invisible neurological defense mechanism?
Where your brain has simply muted the connection to protect you from the echoes of past trauma. It demands that we ask a much harder question. Do we need to aggressively fix our muscles? Or do we need to focus on slowly, gently teaching our nervous system that it is finally safe to feel again?
Suddenly, treating the pelvic floor isn't about finding the perfect yoga pose. It's about rebuilding a shattered mind-body connection. Take a deep 360-degree breath into that thought, let your pelvic floor soften and drop, and we'll see you on the next deep dive.